morning, everyone, or good afternoon, depending on where you are in the country. My name is Matt Henson. I'm the marketing manager here at Ezderm. Oh, I just want to thank you guys for taking the time out of your day to join us for the webinar. So in today's session, we're going to take a look at how AI can actually drive revenue for your practice, and we'll see how Bonsai identifies missed opportunities in your own data and turn them into actionable processes and appointments. You're going to hear from a couple of people from an Ezderm and Bonsai practice on how they're using Bonsai, and they're going to walk through what their practice looked like before Bonsai and after Bonsai. So with that, I'm going to go ahead and turn it over to Travis to get us started. Travis, go ahead and take us away.
Great. Thank you, Matt. Really appreciate the opportunity to be here today. My name's Travis Schneider. I'm the founder and CEO of Bonsai. I'm joined today with a colleague, Rick, who is our Chief Revenue Officer. And we're fortunate to have Dr. Pickup and Jessica from Dermatology Specialists of Greater Cincinnati joining us as well to share their experience with Bonsai. I think we want to have this call today be fairly interactive. We're here to obviously share a little bit about Bonsai, share a demo of the product, but we really want to hear about Dr. Pickup and Jessica's experience using Bonsai and answer any questions. And so with that, I'll go ahead and jump in. I thought a good place to start is just to share a little bit about our background, who we are, where we came from, and why we started the business. And I'll just cover this very quickly, but our team, we're headquartered out in Santa Monica, California. Bonsai is still a fairly early stage company. We launched the business about 2 years ago. As an aside, Dr. Pickup was probably one of our first Ezderm customers to partner with, which has been great. Our team today is about 24 individuals, all of which come from a pretty diverse background in healthcare technology. I was previously the founder and CEO of a tech company called Patient Pop, then co-founded a company called Tebra, one of the EMR's practice management systems. Rick and a number of others come from ModMed, and we've got a number of shareholders and advisors that come from some of the large healthcare technology platforms. So collectively, we've probably spent most of our careers in healthcare really trying to understand problems that independent practices face and how we can build technology to help solve some of those. One interesting note about Bonsai is we're 100% focused on dermatology and by extension aesthetics. We're doing our best to go as deep as we can into dermatology and really build a product that is best suited to the unique characteristics of a dermatology practice. We're venture backed, and a number of our early customers are also investors in the solution. So that's a little bit about our background, the company. I won't spend too much time on this, but our founding story is an interesting one. We had a board member at our last company pass away from melanoma. Obviously, that was sad. It caused me and my co-founder to ask the question, how in this day and age does a patient like our board member not get a notification from the practice to come in for an annual skin check? How is that being missed? How is that overlooked? We were really curious to understand that. And we ended up going out and talking to a number of dermatology practices that we were familiar with. My personal dermatologist, customers of our last business that were in dermatology. And we just asked them, what are you doing today to stay on top of your existing patients and ensure that they're coming back in when they should be? And it was interesting because almost universally we heard the same thing, which is every practice seemed to be tackling this in a very manual way. And it seemed to be very challenging for them because no one has the time to spend all day on this. And it seemed to be a very manual, clunky process. And it also was an issue that extended beyond just patients that needed to come in for an annual skin check. When we started to look at the data, we realized that in any given practice, there were all kinds of patients that needed to be scheduled for something, and they just weren't. Obviously, patients that were overdue for care was a big one, but we also saw issues around cancellations and no-shows, patients that cancel for whatever reason, and then for some reason or another, they never get back on the schedule. We saw a big gap around patients walking out of a practice after their appointment and not having an appointment scheduled. And so there were all these use cases where the front office teams were stressed trying to stay on top of these patients and spending a lot of time trying to bring them back in. And so we thought there's an opportunity here, especially with AI, to build technology that could really help practices stay on top of every single use case with respect to their patients to ensure that they're being reached out and scheduled when appropriate. What was compelling from a business perspective was we said to ourselves, this could be a cool solution to help close gaps in care, like if we look at it through the lens of a patient. But then when we also looked at it through the lens of a practice from a business perspective, what really stood out to us was all of these patients that needed to be scheduled that weren't was creating a really big revenue gap in the practice. We call that hidden revenue today, but even the small practices, single locations, what we could see in the data, we're sitting on north of $1 million in what we called hidden revenue opportunities. So revenue potential that wasn't being realized because it was difficult for these practices to stay on top of this. So that became the catalyst for launching Bonsai. We call it a front office automation engine. We're leveraging the latest in AI and technology to do three things really well: identify patient opportunities, engage patients automatically, and schedule visits end to end. And so I'll walk you through a demo of Bonsai later, but I thought with that background, maybe I'll hand it over to Rick and we can talk a little bit about the experience that Dr. Pickup and Jessica have had.
Awesome. Thank you, Travis. And again, thank you, Dr. Pickup and Jessica, for joining us on this webinar. I think a lot of the folks that are either listening live in real time or getting this recording are going to really want to hear from you versus me. But as you can see, Dr. Pickup is the founder of the Dermatology Specialist of Greater Cincinnati. Actually, took over the practice. It's been over 50 years in practice and sees over 29,000 visits annually. Consists of two MDs, two physician's assistants, and one nurse practitioner. They focus on a mix of both, general derm along with cosmetic, and we'll go over that today. But Dr. Pickup, if you can share a little bit about the background of your practice. Of course, 50 years ago, I'm sure you weren't even around it then. So if you can get a little bit of background of when you took over the practice and then when you moved over to Ezderm.
Sure. So my practice is based in a suburb of Cincinnati that, again, has been very well established by founder Lee Vesper, who passed away a couple of years ago, who ended up being my patient. We've been in the area for 50 years. I joined the practice about 17 years ago, of which time I had two other partners, both of whom have retired since then. So it's solely my practice at this point. I have another dermatologist who's worked for me for the last 3 years, two physician assistants who've been with me 7 and 12 years, and a nurse practitioner as well who's been with me for a long time. So very high volume. We're a one location practice, but a busy practice. And like you alluded to, do a lot of general medical care, general excisions, surgical excisions in the office, and then have a cosmetic component along with an esthetician. And we also do radiation for some skin cancers.
Right. And you're on Ezderm. I think you moved over to Ezderm 3 years ago.
So interestingly enough, the person who originally started our practice had an EMR like 40 years ago. So he was way ahead of the game. I have patients who come in at this point who think they're new, but I have a note from them from 1982. So sort of interesting. He was way ahead of the game. We had been with a smaller company who was actually sold. And so about almost 3 years ago, had to make a switch onto a different EMR, which is a huge undertaking and super stressful. And we looked at a multitude of different options, Epic, which I'd had familiarity with from residency, and of course, MonNed or Emma, and Ezderm. So I had colleagues utilizing all of them. For us, Ezderm tended to be the best fit for us. Again, I think owning a private practice, I'm always looking, what's most efficient for us? What's the bottom line? I want to be able to save money. I'm not the large healthcare organization that has multitudes of different amounts of money coming in. I don't have that. And they were a good fix for us. So, dermatology specific, we were able, and I am quite OCD of how I like to create things. So I was able to create as many macros and change them up as much as I could to really make it the most efficient for myself and other users. And so it was a relatively easy transition. Never fun, but I'm so glad that we've done it at this point.
It's great. And I do have to give a webinar shout out to Erica De La Garza, who was part of that implementation team. As we talked about, she did an amazing job. So now that we're talking about bonsai, if we don't mind shifting over to Travis, thank you, Dr. Pickup. That was a great background. Seems like obviously patient care is really important to you. If you don't mind, Jessica or Dr. Pickup sharing a little bit about, what did you think about when you talked to existing patients, and what did you do for outreach prior to bonsai for those that have lapsed for treatment on both, skin conditions, annual skin checks, any cosmetic treatments? What was your process pre bonsai?
It was a very manual process. Like Travis said earlier, we really tried hard to make sure our melanoma patients, our skin cancer patients, that we were touching them as often as we could. But as many of you know, the process is very manual, running reports, creating to-dos. So it was very, very reactive process before, to where now we're able to be proactive and reach out to patients, even before they're due for an appointment if there's not one already on the books. So it definitely has freed up a lot of time from people who are going through things manually to just being able to take care of them while they're here in the office.
All right. So let's talk about a little bit about the process. So, pre bonsai. So just step us through, when you thought about getting a patient back in due for their skin screen, 12-month or 3-month or 6-month, what would you do within your practice to do the outreach, if anything?
Yeah, mail letters. Again, it wasn't something that we were doing consistently. We were doing it when, a provider was on vacation, or we had the staff to fully delegate this to someone. But being a small practice, most staff are for the patients that are in the office. We're not able to staff to do some of this paperwork consistently. So again, for our melanomas, for our skin cancers, if they didn't have an appointment, then we would run reports and we would mail them letters or call them. But again, very manual process, and there's definitely room for improvement there.
Right. And arguably probably a pretty heavy lift. We just mentioned, not only just pulling the list, understanding who's on a future appointment, and then having to mail letters, which is costly, not only just staff costs, but also stamp costs. And how did you track results? Did you sent out a mailer and just hope that you saw a surge in visits, or did you track results at all through that?
No, there was no tracking. We would just, again, run the report again the following month, and whoever hadn't fallen off from the month before, then we would just reach out to those patients again.
It sounds like a very common practice. This is a very common situation amongst dermatology practices. Dr. Pickup, in your view, you've been practicing dermatology for quite some time. Um, when you think about the patient continuity and closing gaps in care, I'm assuming that's hugely important. That's why you're a practicing dermatologist. Tell us a little bit about, the importance of making sure folks, like, talk about skin checks or skin screens, annual skin screens are to your practice.
Sure, absolutely. I mean, it's the bread and butter, right? So general skin checks, skin cancer screenings, biopsies, getting those patients back is a huge portion of our population. We, try to do the best we can with scheduling patients while they're in the office, or follow-ups in 3 months and 6 months. I think we did a decent job of that already. But it's hard to sort of track those patients or hope they're coming back. And that's one portion, let alone the patients who end up calling because, they're out of refills for their medications for acne or rosacea or hair loss, or their methotrexate for psoriasis, because they didn't have follow-up appointments sort of scheduled. So the workload on everyone, those patients calling, leaving messages, us calling back saying, you can't have a refill, you haven't been sent in patient in clinic, has, Bonsai has helped reduce some of that. I think one of the bigger things is, one of the biggest ways, I think, that you can look at a practice and tell if it is successful or not. And there's a number of factors, but one of them is your schedule busy? Is your schedule full?
Right.
And
Right.
if it's not, then everything else sort of falls off, right? And so I think we were a busy practice, but there was openings, there were ability to add back those patients, and not having to go out and find new patients, not spending money to find a new patient to bring them into the office, but using our resources we already had, which were all of these thousands and thousands of patients who just needed sometimes a touching point of, oh yeah, I did cancel that appointment, or someone was sick, or we had a snow day and I never called back to schedule that. So
That's the perfect segue. One of the things you and I chatted about was, you really don't do a lot of marketing. You have a practice that's been around for 50 years, 29,000 patients annually, but you do see the importance of, you have your existing patient base. How do you make sure they're coming in regularly? So it's a perfect transition to the next slide, Travis, and how you found Bonsai. And then we'll talk about the impact it's going to have in your practice for those outreaches. And so, Dr. Pickup, maybe the question is, and then we'll pivot over to Jessica's. You don't do any marketing for your practice, but you do see the value in existing patient base. So maybe either you or Jessica can answer, like, how did you learn about Bonsai? Because as Travis mentioned, you were one of our first Ezderm customers. You don't mind sharing that? And we'll get into how Bonsai's.
Yeah, I had other colleagues or friends of mine who in other states that were utilizing Bonsai who had mentioned, like, also owning private practices, and they had come across this and had been pretty successful. And people that I trust who probably have similar business models and sort of characteristics of how they take care of their patients. And so I was put into touch with Travis, and he went through sort of a similar setting with me looking at it. So I'd had friends who'd done it. It seemed successful. And again, I think we don't spend money on marketing. I'm not, running Google ads and doing all this other stuff to get new patients. I think the money that you make from a patient is one you've already had. And bring them back into the practice and or utilizing other services. So we have been able, as you'll see, to really go beyond just your skin checks. But the patients that were getting Botox, patients who were doing filler, who were doing vascular lasers, who, had all these different, we've created all kinds of different outlets to reach patients at this point. So it's been very modifiable for us. So that's how. So for me, it's always a leap of faith. Again, I alluded to, I don't want to spend money if I don't need to spend money. And so it's always like, okay, what is going to be the ROI on this? Are we gonna see this? Is it gonna work for us? And so it's a leap of faith. And for us, it's been very successful. And we saw it pretty early on and have had really great feedback from patients. I mean, patients will mention to me like, hey, oh, I'm so glad I got that text. And I'm like, what? Or, I got this email and I forget that we even do it.
Right.
And they're like, oh, because I forgot that, I needed to do this, or I'm so glad I got the reminder to do this. And it worked really well. And luckily, we were newer on Ezderm. And so we were one of the first ones with Ezderm, and Travis and his partners were able to figure it out with the Ezderm crew of how to make this work. And it's been pretty glitch free. I personally can't come up with a problem with it.
Well, that's awesome. And we want to thank Ezderm for this, enhanced partnership that we're building. And we're so thankful to be on this webinar with you all today. So Jessica, we talked about, Dr. Pickup, that was great. Jessica, we talked about the heavy kind of lift your team would have to do, pull lists and send outreach, but let's touch on post Bonsai. So before we get into the impact that's made on your practice, do you mind sharing what was the implementation like? When our team jumped on and said, okay, here's what it looks like to set up and train. Delve into that a little bit for this, for the folks that are listening in, and to tell us a little about, how big of a lift was it for you in your practice to onboard Bonsai?
Sure. Yeah. And Lyft wasn't bad. We started with 3 different campaigns that were kind of standard. Bonsai started those campaigns with all of their new offices coming on. So we were able to customize the communication that went out to the patients in these different segments of the campaigns. We were also able to pick which diagnosis codes we wanted to hit with these different campaigns. Pickup mentioned earlier, like some of our acne patients who wanted refills, take time for us to respond back to the pharmacy and then, reach out to the patient, schedule the appointments. So this kind of proactively generates that the patient's brain, like, oh yeah, I got to get in before I get my prescription. So it was a pretty easy process. And then once we got into it, we're like, okay, now what's next? What else can we do? Once we started kind of seeing the success that we had even within the first month. So it was pretty easy. It was not much of a strain on us at all to create the information. It was more Bonsai and Ezderm figuring it out on the back end. But it was great.
So that's great. And you touched on, which I think is hugely important, is other solutions in the market. We've been around healthcare for a long time. There's change management, and you have to train and you have to make sure that your staff is ready. And Dr. Pickup, you made a comment where you have patients come in and say, thank you for that text about coming in for my neuromodulator, my Botox. And I think with Bonsai, do you agree that we basically, once you set it up, we run it automatically in the background, and that takes off the load of your staff? Is that correct? And maybe you can delve into that a little bit for this automated outreach.
100%. I think we strive to work smarter, not harder. And this is, a great example of that. We personally couldn't reach out to, I think it's been 5,000, 8,000 people on our own in the last 9, 10 months. It would be impossible. So being able to have this help us to reach out to those patients to where, like Pickup said, oh, thanks for getting me in so quickly, then we're able to treat patients like they're VIP. I'm calling patients, or my staff are calling patients that reached out to us yesterday, today. So, just giving that personal touch just makes them feel important, which they are, but it's hard to personally touch 29,000 patients, throughout the year. But this definitely has helped us to make those patients feel important and get, I don't know, what to schedule.
It's important. It's much better than, oh, God, Doctor.
Yeah, of just, and we haven't annoyed patients. I think that was our other concern of just, are we going to be like harassing them where they're going to be like, oh my gosh, please remove me from this list. I don't want to come back to your practice. And I haven't gotten that feedback. We've been very strategic working with Bonsai and the people who help us of like, let's not, touch that one person 5 times. If they've been my skin check and my Botox and my vascular laser, they don't need 3 emails. And so it's really worked out very well. And the customization of using my language, our language of what I want to say to someone. It's not just this automated AI computer blurb that's cold, or it's really customized to them and what that condition is and what we're trying to say to them. So I think there's been a couple patients who've asked like, oh, can you take me off the list because they like moved to San Francisco and they're not, going to be my patient anymore. But for the most part has been very, easy to work with, positive, and softens the practice a little.
That's great. And Jessica, you don't want to go back to printing lists and then mailing, stuffing mailers, and you don't want to go back to that. So
No.
we're all in agreement that Bonsai is helping you. Matt has to worry about.
Younger people don't want to, they want the
Yes.
email. They don't want.
That's right. That's right. So we're going to go through this really quickly, and then we're going to pivot over to the showing a demo to the folks that are here live. But your feedback is critical, and thank you so much for sharing. As you can see here on the slide, these are not uncommon results. These are results, as Jessica and Dr. Pickup said, are pretty apparent. The goal is to not only just help drive additional revenue through existing patients, but it's also closing gaps in care. It's getting those folks back in for lapse in treatment, not only just cosmetic, but also for medical as well. And I know I leaned into skin checks and skin screens, but we do map pretty much every single condition you'd like to be able to reach out to that are due for some form of relapse treatment. So as you can see here, not to go through line by line, the results are pretty apparent. We're really thankful for Dr. Pickup and Jessica and the partnership early on with Ezderm, and we're just looking forward to continue to build this relationship with you all. We're going to pivot over and show a demo, but it's not the last we're going to hear from Dr. Pickup and Jessica. Hopefully there's questions that come in. Feel free to hit the chat up, as Matt said. So Travis, I'm sure you're going to jump into the demo now.
Okay, so I'll take you through a quick demo. This is another practice that we're working with that is on Ezderm. And and what you're looking at here is the dashboard. So this is what an Ezderm practice would see when they log into their Bonsai dashboard. And so step 1 is we are plugging into Ezderm. We are analyzing all of the patient data that's in your system. As an aside, one way that we use AI today is behind the scenes. It helps us analyze and make sense of all of this unstructured data, and it helps us surface insights. And so the first insight, or the first area that we focus on, is the data around patients that are overdue for treatment. And the way that we present that information is like what you see here, where at the very top, a practice can log in any day. This is real time. They can see how many patients are overdue for treatment. We can see in their data what their average revenue is per visit. So that's where these numbers come from. These are based on the practice specifically. They're not some industry average. And then we can size up how big the revenue opportunity is. So this particular practice has 3,300 patients that are overdue as of today. Their average revenue per visit is $356. That's a combination of all of their medical as well as cosmetic procedures. And so if we were successful in bringing all of these patients back in the door, this practice would generate just over $1 million in revenue. As an aside, we're never going to be able to bring every patient back in the door, but we will convert a high percentage of them. And I'll show you what those results typically look like. What's more helpful to the practice, we find, is we break it down by appointment type. And so when we partner with a practice, we identify all of the medical and cosmetic recurring procedures and we pull them into the dashboard. And for each one, we're pulling in how many patients are overdue, the average revenue per visit for that particular appointment type, and the total potential revenue in that cohort of patients that are overdue for that service. That's step one. And you can see here, it's all for all medical and cosmetic procedures. The second step is we automate the outreach to these patients. And I'll just walk you through briefly how that works. Step one is we are sending, these patients in an automated way, an email as well as a text to let them know they're overdue. One nice thing about our solution is this is automated for the practice. So nobody on the practice team has to create an email or create a text. Bonsai does that for the practice. But like Dr. Pickup and Jessica mentioned, if the practice wants to make any changes, it's really easy for us to do that. But out of the box, we have standard messaging that goes out to these patients. It is customizable and it's unique for every appointment type, which helps with conversion. Here's an example of it. A patient that's overdue for Botox, they receive an email. We configure it and set it up and send it in such a way that these communications look to the patient as though they're coming from the practice. So no patient is getting an email from Bonsai. It's coming from the practice domain. We're very deliberate and intentional with the messaging that we create. In other words, we're creating very professional sounding messages that one would expect to receive from a provider. In other words, we're not sending like marketing messages with big discounts and call outs. It's very direct and professional. And at the end of the day, in the body of these messages, we're providing the option for how to book the appointment. And really what we're doing here is just connecting the patient to whatever the current way is for that patient to book an appointment with the practice. Often we include a phone number to the practice. If the practice has online scheduling set up, we will link into the online scheduling tool. Some practices prefer patients to fill out an appointment request form. We can be flexible to build that into these messaging. So we're not creating a new scheduling, method for the practice. In the kickoff call, we walk through this messaging so practice can see what's being sent before we go live and they can make any changes. We also walk through what we call the schedule. So how often are these patients being contacted? We typically have default settings that are populated here based on what we've seen to be yield the highest conversion rates. But again, it's very flexible. So if a practice wants us to contact a patient more often or less often, it's easy for us to do that. And then that's sort of how we set up the automated outreach. Once that's complete, the practice can then determine what campaigns to turn on. So as an example, we have some practices that are extremely busy and they say, if we're fortunate or if we have an opening on our schedule, we want to fill it with the highest value patient, not just any patient. And they can do that with our system because they have the flexibility to turn on any campaign that they like. And so often practices are turning them all on, but we have some practices that want to really lean heavily on cosmetics. They're growing that part of their business. And so we focus on just turning those campaigns on. And again, that's some flexibility that we have for each individual practice. So that's where we started. The company was around overdue campaigns. And since then, we can pull other opportunities out of the data. The next automation we built is called no-show and cancellations. And this is looking at patients that have canceled an appointment or not showing up in the last 60 days and have yet to get rescheduled. And so we can detect all of these patients that are about to slip through the cracks. And again, we can automate the outreach to those patients to help the practice get these patients rescheduled. And so that's the second automation that we've launched. We also have an automation around reactivation. And this is looking at patients that haven't been in the practice in more than 2 years. So some might say they're effectively lost. We don't look back patients that haven't been in the last 20. We're really looking at patients that haven't been in 2 years, but less than 5 years. And we put them in the reactivation campaign and again, automate outreach in such a way that we can try to help bring these patients back in. And so that's a general overview of how the platform operates today. We also have a results section where we track all of the activity, so a practice gets a really clear understanding of how it's performing and ultimately what their return on investment is. So this particular practice, and these are real numbers, has generated just over $500,000 in revenue from Bonsai. They've been live on the platform for less than a year. But what they might really want to see and drill into is for each campaign, for example, fillers, how many patients were contacted? How many of them booked? What was the conversion rate of the filler campaign? How well did it perform? How much revenue did I generate from that particular campaign? And one of the things that we added recently, and I'll just show you the totals here for a second, is today we're tracking not only patients contacted and booked and the estimated revenue, but we're now able to track the actual dollars collected in the practice. So in this example, which is sort of unique to be honest, this practice has collected more revenue than we've estimated. And that's likely because the patient has come in for one treatment and they've ended up getting a subsequent treatment done. And in this particular case, this practice, as of today, has collected, more revenue than we've estimated, which is obviously a net positive. And then you can see here we break it down into and by the results by automation. So for no-show and cancellations, they can see how well that's performing relative to reactivations or overdue treatment. And so that's a general overview of the platform. Rick, did I miss anything before I move on?
No, just the clarity around, I think doing that manually, just a level of effort to pull the data, excluding those around a future follow or on appointment, making sure that when we do the outreach, if someone clicks on a campaign, that we remove them from a campaign. So the logic, as Dr. Pickup and Jessica pointed out, is we're not bombarding them with messages if they're already engaged with the message. And that feels like it's a real custom outreach from the practice. Every outreach comes from the brand of the practice. There's no Bonsai branding whatsoever. And the real cool thing is I talked about with Jessica and Dr. Pickup is that the light touch on implementation is due to the fact that we route all the patients to whatever the current active patient intake process is currently with the practice. So why there's virtually really no training that's needed is because every one of those messages get routed to whatever your current process is today. So if you have an online scheduling solution, if you use a form, or if you have a specific phone number you want to route it to, you just basically, I think the Dr. Pickup called us out where they had patients come in and say, thank you for that text message. In a lot of ways, you just set it, let it run. Because in the background, we're routing all those patient inquiries to the current process. Jessica, you could touch on that slightly. I think that was probably really helpful when you think about other solutions that probably require a bit of training for your front desk and your billing teams. Talk a little bit about, if you don't mind, how that works for your practice. So you don't have to worry about them being trained on bond.
Yeah, there's literally nothing. Travis, you might want to talk about the leads and just how those patients can reach out through the emails, and then it populates for us to call those patients back on the leads. But outside of just showing my front desk staff, I worked those leads for the first couple of months just to make sure I was comfortable with what was coming back and making sure everything was correct. But it didn't take much time at all for me to feel comfortable and then get over to the front desk staff and train them on where to look there in the system and how to complete them. And we were able to fill in cancellations in the same week or the week following with those leads. So that's been a great addition. But again, outside of showing them how to do that, there was really no training needed at all. There was nothing.
Oh, that's a good segue, Jessica. I was going to share one innovation that we're launching this quarter that's going to help with what you just described, staying on top of the leads that are coming in. And it's AI scheduling. And so this is a product that we've actually built. We have it live in beta with a number of customers. We're working out all the kinks, and we plan to bring it to market or general release later this quarter. But what's really cool about this is when we send out a communication to a patient, let's just say it's a text message, letting them know they're overdue for Botox. Today, as we just talked about, that patient has to call the practice or fill out an appointment request form, and they still have to have some level of communication and back and forth with the practice to get that appointment scheduled. Often, or not often, but we do see they don't always end up getting that appointment scheduled. And so with AI scheduling, when we send a text to a patient to say they're overdue, if that patient wants, instead of having to call the practice or fill out a request form, they can just respond to the text message to say, yes, I'd love to come in. How does your availability look next week? And our AI agent can actually read the schedule in real time, pull out the options, go back and forth over text with the patient to confirm a time that works, and then update the master schedule. So that whole booking experience has now been done through AI without any person on the staff having to get involved. And we think this is a really cool new solution because it will not only take more work off the plate of staff, but it'll also drive even higher conversion rates because we'll see more patients schedule because it's much easier for them to do it. And so, as mentioned, we're launching the AI scheduling agent via text now this quarter. And then the next iteration of that will be to have an AI voice agent that can answer the phone and do similar scheduling activities. I'll just keep going here, Rick, if that's all right with you. And maybe just so we don't run out of time and we have room for questions, why don't I touch on pricing and then we can segue into Q&A.
There's a few questions that have come through, so we'll definitely make sure we spend some time.
Okay. All right. Well, let me just go through this because I know everyone wants to know about pricing. So here's our standard pricing. We have a one-time implementation fee. That's $1,000. We have a base platform fee that includes one license. A license for us is a provider license. So the base platform fee of $500 a month includes one provider. And then additional providers are billed at $250 a month. And then given our partnership with Ezderm, we've come up with a discount of $500 to apply to implementation. And that's just a snapshot of our current pricing model. Anything to add to that, Rick?
Oh, happy to discuss pricing if we're able to connect with any of these folks on the call directly.
And then one thing that we wanted to offer to anyone that's on the webinar today, or at least for the first, I think we said 20 that were responsive, we're open to pulling your data and showing you what the opportunity looks like for your practice. And we're open to doing that without any sort of commitment. We think it might be really helpful for practices to see just how big or small the opportunity is around how many patients are overdue, et cetera. And so if anyone during this call wants to take advantage of this, we'd recommend connecting with us after the call. And we won't be able to do it for everyone. It is a big investment for us, but we are happy to try to accommodate a number of practices that reach out following the call. And then I'll just leave you with this. I think Matt has surfaced other ways to connect with us, but if anyone wants to connect with us directly, here are our email addresses, and we're happy to continue the conversation.
The great thing about this opportunity report, before we move on to some of the Q&A, is that this is a no obligation opportunity report. It's basically just showing you, what are you looking at in terms of patients that are overdue for treatment. At the very least, you can see folks that are needing to come back in for certain procedures, along with no-show cancellations and those reactivations. So we're hoping to connect with each one of you on discussing an opportunity. And then the email addresses are very simple. You can, Rick at Bonsai Health, Travis at Bonsai Health, Max at Bonsai Health. We're all go-to-market leaders, sales at Bonsai Health. And also I think, there's obviously links that Ezderm provides, so you can actually input direct information. We're just happy to connect with you directly. Moving over to some Q&A, Matt, that's okay? Maybe for the folks on the call, as we have a few minutes.
Yeah, absolutely. And thank you for kind of setting it up. As Rick mentioned, we did have the poll here, and in your post webinar email where you get the link for the video, you also have a link there if you are interested in getting your free opportunity report by completing a demo with Bonsai. Just a link there that you can sign up for that. So you'll see that in your follow-up email. We do have a ton of great questions in here, so I want to go ahead and get started with those. We've answered some of them in the chat, but just for the whole class, I want to kind of read some of those as well, because I think it's great information for everyone. So first question we have here is, besides specific campaigns, can you build the option to remind patients in which a follow-up was entered? So I think he gave an example saying, let me find it here, one second. Like a patient has a rash follow-up, it's entered to happen in 2 weeks, and the patient never scheduled the follow-up. So is there a process that, follow-up messages can be sent after that? And Rick, I think you answered that question in the chat, but just maybe kind of go into that.
Yeah. So I think what Bonsai does is, as Travis alluded to, is we are able to map our agents. Objective AI is able to map production data, which is on the schedule, which is super important for cosmetic procedures there's no common naming convention for cosmetic procedures. So Bonsai is able to normalize and standardize production data along with ICD-10 CPT codes. We do not read notes. I think that's one of the things that Bonsai, we not do any OCR scanning or any note scanning. But to answer that question a little bit specifically, if you have someone that is due for a 3-month skin check and they have an ICD-10 code that's a high risk melanoma patient, because it's actually mapped to an ICD-10 code, we can actually discuss with the practice, what interval would you like us to start reaching out to? So if you miss the rebooking at the point of care, you don't get them rescheduled at the checkout, Bonsai can take over and reach out to those patients once they meet that, let's say 90-day criteria. I don't know, Jessica or Dr. Pickup, you want to touch on that a little bit about how you don't necessarily have to worry about the booking at the point of care for those patients that are due for a more regular skin or checkup, not just skin check, but other conditions. Bonsai takes over and reaches out. Maybe you could touch on that slightly before we move on to the next question.
We've always done a great job of making sure they're scheduling while they're here. We feel that's the best way to make sure that they're returning back to the practice. But we have intervals, right? So like with those acne patients that we know are going to come back for 3 months to get that refill medication, we have those sorts of diagnosis codes set to reach out every, I think, 80 days or something. Botox is every 90. Filler is, once a year. So just based on your diagnosis code and how often you want them to be touched, they can customize anything you want. They have for us.
Awesome. Yes, that's exactly right. Matt, let me throw a question out there because I'm seeing the chat as well. I know we're running up on time, but if there was a great question, whether or not it's Jessica or Dr. Pickup or even Travis can lead into, it's, how do you prioritize communication? Because there are patients that fall under multiple campaigns or procedures, right? They're due for an annual skin check, but they also fall under, let's say, a filler or a Botox. How do you prioritize the campaigns and the outreach for those that fall under multiple campaigns? Maybe Jessica, if you do,
I'm not sure that we've discussed that. I feel we didn't want them to be touched multiple times in different campaigns, but I like the idea of making sure that we're, doing it. We're thinking about that. I don't think that we have, Travis.
Yeah, good. So Bonsai can prioritize. So if they fall under multiple campaigns, Bonsai can prioritize which is the most important outreach, that the practice wants to have for the first touch. So that we could discuss during a personal call or during implementation.
Awesome. Thank you guys for answering that one. Kind of second question here, and this goes along with campaigns. Can you block or exclude certain patients from getting messages? So that may be a patient that's left the practice or a patient that you no longer see anymore, et cetera. Can you exclude them from those campaigns?
The answer is yes. We don't do it systematically at this point. You would have to, if you can pull the list of exclusions from Ezderm, we can send it to our implementation team and they can exclude those folks from any campaigns.
Okay. And what I do on our end is if we get someone, patient emails back or calls, says, hey, I moved out of the state, or, we've no longer a patient of ours. If they forward the email back to me, I can quickly just, unregister them. But if I don't have the email, I just email our contact at Bonsai, and within the same day or next day, she's reaching back out to me, removing it. That is one thing I asked Sarah to maybe add to the system is just, I can log into Bonsai and just remove the patient myself, but I hear that's in the works.
Yeah. And if they're deceased, if they're marked deceased within Ezderm, we will not send them, of course, not send any of those messages out. We can do that automatically.
Another question kind of along these lines here, and this comes from a 9-year EasyDerm user. So thank you for being, a customer for 9 years. That's awesome. They just asked, can you explain what data Bonsai is actually using to qualify a patient for a campaign? I believe it's tied to campaign types, or not campaign types, visit type or something like that in the EasyDerm system. They said they just had some complications with appointment types in EasyDerm. So just kind of the question on what data are you pulling to qualify people for a campaign?
Sure. And Travis, please add. And I do see, we'll definitely reach out to this particular inquiry directly. As I mentioned, we do read production data, so we can actually normalize and work with the practice on what cosmetic procedures or appointment types we like to normalize in the actual dashboard. And then CPT codes, so procedure codes, and ICD-10 codes is what we currently map. And I see the question, so we'll take notice to reach back directly to this person regarding their question. Yep.
Absolutely. Another question here just on communication, and I think this kind of goes into just the language options. Can communications between Bonsai and the patient be another language? They asked specifically for like Russian, Ukrainian, Uzbek, or Georgian. But I guess any other languages, can communication be sent like in their native language?
Yes, working with the implementation team only on email at this point. We can actually work with the practice on the translation and the message, and which procedures they would like to use that particular language, but they would have to work with the implementation team on that.
Okay. This one kind of goes back to just kind of follow up appointment reminders or messaging. It says, how does the system know that a patient is due back for an acne follow up in 3 months versus 6 months? It appears as it's driven by the ICD codes, but how does the system determine the return date for their like follow up appointment?
It looks at the last appointment visit with. Oh, go ahead, Dr. Pickup. Sorry.
I was for us, we sort of said, where do we want them to come back? I mean, it's not going to say, well, this person's 8 weeks and this person's 12 weeks. But I think maybe for us, we said, maybe 6 months or something like that. Just thinking about like what would be the normal refill amount for a medication that may be less for an antibiotic, but it wasn't going to be a yearly appointment necessarily for giving you antibiotics. So we've switched ours around based upon how we normally like to follow up with patients.
That's the perfect answer. And the way we read that is we basically read the last time they were in for that particular appointment. And that's the date that we trigger, whatever interval that Dr. Pickup or Jessica want to place on that particular procedure type or campaign. So, but Dr. Pickup said it perfectly.
Awesome. Thanks, Dr. Pickup. Next one, and I love this one because it is definitely kind of a marketing related one. Can campaigns be used for promotional ads such as like Botox or specials, etc., through the practice or through Bonsai?
We currently do not have broadcast messaging or these kind of messages, but we can do specific campaigns for like reactivations. We're working on building that capability because it's been a pretty big ask from our practices, we call it broadcast. So special messages that go out for an event or a new office opening or a new provider being added to the practice. That's currently in the works. I can't promise it's going to be in Q1, but it's definitely been a heavy ask from our practices.
Okay. This question. Oh, sorry. Go ahead, Jessica.
I said our practice included. Yeah.
I think this question kind of goes around the AI scheduling feature that you guys have in beta. It says, is the AI able to understand scheduling rules, or is it just looking for like the next open slot? Can it double book patients or overlap with other appointments?
Yeah. And Travis, please lean in here. But I think the AI scheduling is currently in a limited number of practices now, as Travis alluded to. We're trying to have this go live sometime, this quarter, early Q2. But the idea behind it is we're going to, build some tools that enable you to enter logic you would have if you train a front desk staff about making sure the schedules are important per physician or our NP, where you can say, don't double book rash patients. Don't book me a new patient before lunch. Don't do this particular patient on Medicare after the certain time of the day. So basically how you would train your team, you can actually train the Bonsai agents to have the logic behind how you solve for those scheduling complexities. Travis, if you want to touch on that slightly, that'd be good too.
I would just say yeah, no, just in summary, one of the greatest unlocks that can happen with AI is around when we set up AI scheduling for a practice to be able to train the agent on all of the unique rules that particular practice has. And having been one of the early in our last business, we were one of the early pioneers of online scheduling. We powered it for something like 10,000 practices. It was always challenging to get that scheduling tool to have the flexibility to accommodate any rules within a practice that weren't just standard. But with AI, like Rick said, you can train that just like you train, someone on your team to understand all of the rules and make sure that the scheduling follows those. So that'll be a pretty exciting feature of AI scheduling.
Yeah, if I may share, Matt, I mean, one of the things, I mean, voice is a very hot commodity now. There's a ton of voice solutions out there. I'm sure Dr. Pickup and Jessica get calls quite often on introducing, a voice solution. I think what we want to do is solve for those complex edge cases. So certainly we can do a nice job of scheduling folks that are traditionally coming in for a Botox treatment, but how do you solve for those that are more complex? Where it's a more natural conversation between both the text agent that we would launch along with voice when we're ready with it. So that's what the team is really, really working hard on solving for, along with the training of the actual agents themselves. And I'm sure, Jessica, you want to look at being on the early beta for that too, along with broadcast messaging, I hope.
Yeah. Interesting. So
Okay.
are you not demoing this right now with Ezderm, with someone else?
We're launching with another solution now, but we're going to be releasing it broader with Ezderm as we start tapping into the API.
This question here kind of goes along like wait lists. So if they have a wait list in the practice for patients that can't get in, that just need to get scheduled, is there a list or a way that Bonsai can pick up that wait list, and if there's an open appointment, schedule them for that?
That's a future capability that is also in the works. That's Travis, is how you come off mute. Maybe you can address that.
Yeah, it is. We're calling it open slot fill. We're going to launch it soon. I think during the demo, I shared overdue treatment, no-show cancellations, reactivations. The next one is open slot fill. It will help practices keep their schedules full. It'll detect when there's a last-minute cancellation, there's an opening on the schedule, and it'll intelligently identify who an appropriate patient might be that's waiting to come in to see if they want to come in and grab that slot. So that is something that we're building, and we'll have that in the first half of this year.
Great. Thanks, Travis. One question that came in here, if we wanted to just start small, what's the first thing, in Bonsai that we would turn on, or maybe just a small part of the solution that could be used?
Yeah. I'm going to see if Jessica can answer that question. When you first, I think you mentioned this a little bit on the call, like what would you start with first if you were?
It was 3. I think it was the 1 year follow-ups. Maybe maybe Botox, neurotoxin, and I can't remember the third one.
Fillers. That's where we started with.
Fillers. It was fillers. Yep. So those were the 3 that we started with. And I think we have 120 patients scheduled within the first month. Yeah. I looked back this morning to have that for you guys.
Amazing data point.
Yeah, we definitely started small. That's for sure.
Yeah. Well, we just weren't sure what it was going to, how patients were going to call. We just want to overload our staff with trying to get patients in. And we started, I believe, in May. So our schedules were already pretty full. So we just didn't want to overproduce what we could take on. So, but
Yeah, and I think early on, you helped us mold that outreach plan. So I think we know that we don't want to just bombard, 3,000 patients with messages. How do we throttle it so your staff is ready for 120 potentially new appointments in the first 3 to 4 weeks?
yeah.
So thank you for helping us mold that.
2 or 3 every month after that. I think now we're up to 14. And we're trying to reactivation one soon. I think we have 3 patients in there right now just because We're still fairly new with Ezderm, so we don't have that history, but it's a great feature.
It's cool.
One question here that this may be a little technical, and I don't know that we can answer this on the call, but I'll throw it out there. Erica's on here as well. Does Bonsai understand the EasyDerm templates to book the correct appointment type?
So, and then Erica, you can lean in. We're not going to book the appointment per se. What we do is we route the patient in the messaging for Bonsai to, again, the current intake process. When we develop and launch the agentic scheduling module within EasyDerm, we're obviously going to work with EasyDerm practices that would help us identify the right appointment type, and schedule it appropriately. But as of right now, current state, as I mentioned before, we route the patient within the actual email or text to whatever the practice is, current active intake process is today. And then they're responsible for getting them scheduled in the right appointment slot. And then Erica, I don't know if you want to touch on that. I think I pretty much cleared it up.
You did, yeah. I think you answered it pretty well.
Okay, cool.
And one last question, because we are almost at time. Does Bonsai support two-way texting?
We do not. It's going to be, it's a one-way text. So we send the text message out, and there's actions within the text message that the patient can take. They can click a book now link. It'll route them to, again, whatever process they currently have, or a call now, but we will not support, two-way texting at the moment. In an email, you will see most of the time they take action within the actual links in the email. But we do from time to time hear from practices that they actually do reply. And then we just ask which domain they want to just make sure they support, or which email inbox they want to support. But Jessica, have you had any patients that have responded or replied via email, and has it been a challenge for your practice, or do you see very little responses to the email?
No, we get a lot. Actually, I had a front desk staff member off Monday and Tuesday, so I managed them for her. I think I did 12 of them Monday and Tuesday. And I just call the patients back. If they don't answer, I give them an appointment, a week or two out, and just leave in the comments that left message it's a Bonsai appointment. And we haven't really had many no-shows with that avenue. And then if the patient wants me to respond back an email, then I just email them from my email address.
That's great.
And kind of go from there.
And you can imagine, Matt, the number of outreaches that we do. 12 is not, too burdensome, but I mean, we do hundreds of outreaches depending on which treatment type. And, as we have 14 campaigns running with dermatology specialists in Cincinnati. So 12 is not bad, but we hope they take action in the email itself.
Yeah. And I think it's that VIP touch, they're happy to hear from us, so I don't mind it at all.
Yeah,
Yeah,
absolutely.
that's awesome.
Well, thanks, Jessica, for giving us some insights into that. We are at time, so I want to be respectful of everyone's time. To those that joined us today, thank you. Be on the lookout for your email with the link to the video, as well as the link to sign up if you want to get your free Bonsai demo and your opportunity report. Do want to thank everyone that was on the call today. Dr. Pickup and Jessica, thank you so much for taking time out of your busy day. Rick and Travis, it's always a pleasure to have you have you on a call. Erica, thanks for providing some insights. We'll leave you guys with that. Thank you. Have a good day.